Joining us is a medical doctor, Tony Adeyemi. Thank you for joining us on TVC Breakfast.
Thank you for having me.
Now let's look at the causes of pneumonia, especially in children, seeing it's one of the leading causes of death in children.
Yeah, pneumonia is actually the leading cause of death. It causes 15% of the deaths in children. That's children below the age of 5.
Yeah.
It's an acute respiratory infection, so it affects the lungs. And what usually happens is that the lungs has air sacs in them. They're called alveoli. They are supposed to be filled with air, but instead they are filled with fluid and pus. And the cause of this is bacteria, viruses, and some fungi. The most common bacteria that causes this in children in our own nation, developing countries, strep pneumonia and Haemophilus influenza. So it's an infection that affects the lungs, and lungs is what we use to breathe.
Well, how does this happen? Is it airborne, or how do they contract
so the mode of
it?
transmission for pneumonia is actually through droplet infection. So it's airborne. You could call it airborne. When a child or a person with pneumonia coughs or sneezes, he sneezes this bacteria or virus into air particles, and any close contact with this person can actually inhale the air particles. So it spreads through droplet infection.
Wow.
Okay, so this is the world leading infectious killer of children.
Yes, it
but
is.
we see that at every point we do not hear anything about it. Why is there not much awareness on the dangers of pneumonia, especially in children?
Awareness is actually ongoing at the different healthcare facility levels. Awareness is ongoing because pneumonia can be linked to different things. We have preventive measures for pneumonia, and one of the most important preventive measures, the nutrition, adequate nutrition, exclusive breastfeeding is being talked about at every healthcare center. Every woman that attends antenatal care facility and goes for immunizations has access to hear about exclusive breastfeeding. Also at antenatal, women are also told about immunizations because immunization is a specific protection against pneumonia. So immunization that the children take at 6 weeks, 10 weeks, 14 weeks actually prevents them from coming down with pneumonia. So talking about exclusive breastfeeding, talking about immunizations and the benefits of immunization is a way to advocate for prevention of pneumonia.
When you talk about exclusive breastfeeding, does it have to do with the number of months? Because some mothers do it for 3 months, others 6, some 1 year. Yeah. Does that also count when you're talking about prevention?
Exclusive breastfeeding is actually initiating breastfeeding as soon as a child is born and giving the child breast milk only for 6 months. That's exclusive breastfeeding. No other definition qualifies as exclusive breastfeeding. So it has to be for 6 months because this is the time duration where the child can get all the benefits that is associated with breastfeeding and build immunity that can protect them against a lot of these children killer diseases that we know.
What about children who don't have the opportunity to take breast milk because of a circumstance of death or the other?
Yeah.
What happens to them?
Okay, we have such peculiar situations, right? And we have what we call the breast milk substitutes. Okay. So what's the what they have charged these companies to do is to ensure that the breast milk substitute is as close to the breast milk as much as possible. Even though nothing can replace the breast milk and the nutrients from the breast milk, but the breast milk substitutes they have like quite a number of the nutrients that you can actually get from breast milk. So this would protect the child and also protect them from getting pneumonia. But breast milk is still the best, exclusive breastfeeding.
Let's talk about treatment now for persons or babies who were unable to get all of these benefits beyond the fact that their mothers didn't die, but just circumstances as well. What kind of treatments are they open to?
Okay. Before I go to the treatment, I'll just emphasize again that prevention is still the key, and that's the most important thing. However, if a child has now come down with pneumonia is easily treatable once easily recognized. So that's why we do a lot of trainings, even advocacy for patent medicine vendors, people who are the first line, because anytime a child is ill, they first go to the chemist. So we do a lot of trainings for them. World Health Organization, the standard treatment for pneumonia is an antibiotic, amoxicillin, and it's supposed to be available in all pharmacies, and it comes in a dispersible form such that children from 0 to 12 months can easily take this medication. So what we do is, instead of self-medication, once you know, because there are signs and symptoms of pneumonia, a lot of people confuse it with common cold. However, it's not common cold. Pneumonia, there's cough, there's fast breathing, and there's fever. Even looking at the child, you can see that this child is really, really ill because as he's breathing, there's chest indrawing. He's breathing with difficulty. The nostrils are flaring because he's having difficulty breathing and trying to get as much much air as he can. So mothers should be trained. We do that advocacy, training them on identifying the signs and symptoms so that they can quickly refer to the health facility, because it can deteriorate very fast, because we need air, we need oxygen to breathe.
When you talk about deterioration that can lead to death, so how long does it take if it's not properly identified that could lead to issues of death? And you know that children sometimes cannot, those age, they can't really talk or speak about, express themselves about what they're going through.
Yes, exactly. That's why the mothers are trained on identifying the danger signs of pneumonia. And the danger signs, like I mentioned, the regular signs and symptoms of pneumonia include things like cough, which anybody can have. It could be a viral cough. Fever, there's plus or minus, it could be fever. Then there's usually fast breathing. The child is breathing fast. So even you know that this child is not well at all. Then the danger signs, when you see that this child is already deteriorating, he's unable to eat, he's unable to even suck breast milk, for a child that is still sucking breast milk and probably convulsing, then these are danger signs, and immediately the child should be taken to the health center. Okay. At the health center, antibiotics can now be instituted and given. Okay,
so imagine that a mother notice these symptoms at midnight. What are the home treatments that can be available?
Okay. In as much as we don't advocate so much for self-medication and having medications at home, however, for pneumonia, there's actually an exception where you can actually have the dispersible amoxicillin. That's what it's called at home. So for a mother, there are some of you should have a first aid box. There are some medications that you should always have at home. Anything, because I said it comes with fever plus or minus, so you should always have analgesics, paracetamols that can bring down the fever. And once you have the dispersible amoxicillin, that's the first line of medication for pneumonia, a suspected pneumonia case. And in the morning, you can now take the child to the health center.
All right. Dr. Tony Adeyemi, thank you for your time.
Thank you for having me.
Joining us is a public health physician, Dr. Tony Adeyemi. Thank you so much for joining us on TVC Breakfast.
Thank you for having me.
All right, so the theme for this year is healthy lungs. When we talk about healthy lung, what does it entail?
Okay, healthy lungs just ensures that the emphasis is on our environment, to ensure that we breathe in clean air from the environment. And because it's World Pneumonia Day, one of the causative factors of this pneumonia is indoor house cooking. So a lot of people that do a lot of cooking in-house, especially those that live in like the tenement kind of houses where they cook indoor, or the kitchen is very close to where they sleep, they breathe in a lot of polluted and contaminated air. And this is a predisposing factor to causing pneumonia. So healthy lungs is basically advocating for cleaner air, sustainable environment, an environment that is clean and free from air pollution.
But most of those things we can't control, because if you have to rent an apartment, it is based on your capacity to pay what you're renting. So how about people who are not, well, in those areas that you mentioned in terms of enclosed spaces when it comes to their cooking spaces? What else can they do to ensure that the air is clean when they find themselves in that kind of space?
Environmental specialists, I think, have come up with like alternative cooking methods, which you can do when you have like limited, restricted space, or if you're in a tiny space. So the environmentalists have actually come up, like, instead of using firewood is like one of the major release of pollutants into the air.
And we love
use of
firewood.
Well, a lot of people that do that actually cook it outdoor, and they cook it like away from where people sleep. So the issue is actually when you do this cooking very close to where you have, especially children, because they're the ones that are most susceptible to coming down with pneumonia or any other acute respiratory tract infection. So there are actually alternatives, cleaner energy. The environmental specialists have come up with also. They might be a little bit more expensive than, of course, the firewood or the charcoal that people are used to for cooking. But then these are alternative measures, because we have overcrowding. We have a lot of people. Absolutely. You have so many people that are crammed into tiny spaces. So you now need to think of alternatives. So you can't tell them not to cook, but then you come up with affordable alternative source of energy or source of fuel for cooking.
So how do we combat this? Because you talk about clean air. Apart from, for those who don't cook and still come down with pneumonia, you know, there's some bachelors who don't cook, but they go all around having the fun of their life, go to work and all of that, but still at one point or the other, come down with pneumonia.
Okay, so for like older people, there are so many causes of acute respiratory tract infection, which we can get from even being exposed to exhaust fumes from cars, generator fumes. But for the purpose of this discussion, because we're discussing pneumonia, which is more common in children under the age of 5, the strategy that the World Health Organization, UNICEF, have actually adopted to prevent pneumonia is adequate nutrition, exclusive breastfeeding, and more importantly, the vaccines. And the government has actually done, they've gone a step further. Initially, in our national program on immunization schedule, we didn't have the pneumococcal vaccine, which is a vaccine that prevents against strep pneumonia, one of the causative factors of pneumonia. We didn't have it included in our NPI schedule, the national program on immunization. That program is free for all mothers, so you don't have to pay for this immunization. So what used to happen before was that mothers would have to pay out of pocket to buy the pneumococcal vaccine, and they have to take 3 doses. Each was going for like almost 10,000.
Wow.
But now the government has included it in the schedule, so it's free for all mothers. So now, apart from the HIB, Haemophilus influenza vaccine they receive, they also receive an additional pneumococcal vaccine at 6, 10, and 14 weeks.
Okay.
All right, Dr. Oluwatoni Adeyemi, thank you for your time on TVC Breakfast.
Thank you for having me.
Joining us is a public health physician, Dr. Oluwatoni Adeyemi. Thank you for joining us on TVC Breakfast.
Thank you for having me.
Now, there's been calls by UNICEF to focus for more efforts when it comes to dealing with pneumonia. And Nigeria is set to carry a burden of about 162,000 of the deaths of children with pneumonia. What does that say of our commitment to tackling this disease?
Well, it doesn't say too good. It doesn't say well of us as a nation, because unfortunately we're just behind India in the deaths recorded by pneumonia, and even the children affected by pneumonia. Like, we're second highest. In fact, some read us even as the highest, but India also has a very high incidence of death related to pneumonia. However, we must still commend the government, because the government is still taking some steps to ensure that more children are vaccinated against pneumonia, and that's why the pneumonia vaccine was introduced not too long ago, a few months back, and in all primary healthcare centers, which are accessible to the grassroots level, people at different community levels, they can actually walk into the primary healthcare center and have access to these vaccines that can prevent them from having pneumonia. However, because a lot of them, we have quite a number of people that drop out, and some of them because of religious issues, even the Boko Haram conflict also prevents people from having access to healthcare. So we need to ensure that if we have to do door-to-door immunizations, there are some communities whereby health posts are set up temporarily so that they can reach some of the hard to reach and marginalized areas, so that they can have access to these vaccines. So that's actually the most important thing, because pneumonia is preventable. Vaccines are available. Vaccines have been made free by the government, and you can access them at healthcare facilities.
All right.
All right, so accessing them at healthcare facilities, we see that a lot of times it's not about accessing them, it's about the attitude of the healthcare workers towards people who come for this vaccine. How do we sort out this problem? Because if it's the primary healthcare center, it means that it's a government-owned hospital. Yeah. So how do we sort out these problems? Because this is a contributory factor as well.
Yes, you're right about that. It's actually a contributory factor to why some women would rather maybe solicit for traditional birth attendants or traditional healers, because they have a better rapport with them than coming to the healthcare facility. However, training and retraining is going on to change the attitude. Attitude, it's an inherent thing. It's a bit difficult to change attitude. However, training and retraining is going on to try to change the attitude of healthcare workers towards patients. Because it's vaccination, most times these vaccines come in bottles, so a bottle can vaccinate 10 children, and there are protocols to these things. So sometimes you have to pool your children together, meaning you have to have like a minimum number before you can open a bottle of vaccine to vaccinate these children. So this sometimes discourages some mothers, because they might go to this health center, they might tell them that this is not our immunization day, you have to come back. And transport is a cost. Yes. It will cost them money to come back to the health center. So a lot of them will drop out and miss out on these opportunities. However, the pneumococcal vaccine has been made in such a way that it's just a one shot dose. So like, you don't have, it's not in a bottle, and it's not like 1 for 10. So you just get the vaccine and vaccinate the child. So it has made it easier for a mother to walk into a health center and get the vaccine.
Now, let's look at the issue of deepening awareness. Now, you talked about some women, because of religious beliefs, they do not want to take up this vaccination. Vaccines. So how do we begin to engage religious leaders or traditional rulers to deepen these issues of awareness and help prevent pneumonia?
Okay, advocacy would have to continue at the community levels. The government cannot do this alone, so they work hand in hand. We have NGOs, non-for-profit organizations that try to reach out. They come up with health education materials in a way the community can understand. First of all, they try to understand the bias and the reasons behind their inhibitions or restrictions to wanting to take these vaccines, understand from their point of view, identify the decision makers. Most times, notice that in such communities, they are male-dominated communities, they are patriarchal in nature, so it's the father that is actually the decision maker. Sometimes you could have the mother-in-law, the grandmother of the child being the decision maker. So identify these decision makers. Once you identify them, find out try to understand from their own point of view and try to educate in a way they can understand. A lot of our health education messages, sometimes they are bogus, they are ambiguous, they are complex, they are not in easy to understand languages, they are not even translated or transcribed to the common language spoken in that community. So you need to come down to their level, educate them, let them understand the implication of not taking the vaccines, and I'm sure with that they would buy into vaccinations.
All right, Dr. Oluwatoni Adeyemi, thank you for your time on TVC Breakfast.
Thank you very much.